Welcome to Learn Medical Spanish. Today I'm going to do part 2 of the triage. This is for special populations like people who are pregnant, little kids, and a couple others, dialysis, cancer patients. So triage mainly for the ER or urgent care. So as usual, I'll say the phrases in English and then give you a chance to think about the translation a little bit. And then I'll say it again. I'll say it in Spanish and then I'll repeat it in Spanish. So you'll hear it a couple times in Spanish. All right, so of course these phrases aren't 100% complete. They're not going to cover every scenario, but there should be some useful things to help in this type of setting. All right, so here we go. So let's start with patients who are pregnant patients, pregnant women who come into the ER. So what kind of questions are we going to ask them in triage? And you might see there's a couple questions here that you might not ask in triage, but that maybe providers would ask, but there's some overlap, so we'll see how that goes. So the first question is, when was the first day of your most recent period? ¿Cuándo fue el primer día de su último periodo? ¿Cuándo fue el primer día de su último periodo? So if you're looking at the YouTube version, you'll notice there's some parentheses. So throughout this, the parentheses means you could probably leave out that part of the phrase if you want to and make it shorter. And it would still make sense, but you can add the part in parentheses to add more clarity. So in this case, it's the first day of, right? You could just say, when was your most recent period? When was your last period? But if you want to be extra specific, you could say, when was the first day of your most recent period? And there'll be other things like that throughout this dialogue. All right, so next question. Have you been pregnant before? ¿Ha estado embarazada antes? ¿Ha estado embarazada antes? How many times before this time, referring to the pregnancy? So how many times before this time? ¿Cuántas veces antes de esta? ¿Cuántas veces antes de esta? So you could also say esta vez if you want to make the sentence longer. ¿Cuántas veces antes de esta vez? Next question. How many children do you have? ¿Cuántos hijos tiene? ¿Cuántos hijos tiene? And there's always ways to add more words, add more clarity or whatever. You could say ¿Cuántos hijos tiene usted? So they know who you're talking to. But those are just little grammatical things. But you could change out hijos for niños if you want to. That kind of means young children, whereas the hijos just means any children, sons and daughters. So depending on the context, obviously they could have teenage children, so it just depends on what you're going for. All right, next. Have you visited an OB for this pregnancy? ¿Ha visitado un obstetra para este embarazo? ¿Ha visitado un obstetra para este embarazo? What's your OB's name? ¿Cómo se llama su obstetra? ¿Cómo se llama su obstetra? And like always, there's ways you could change it. You could just say, ¿Cómo se llama el doctor? Or la clínica, like what's the name of the clinic or the doctor. But in this case, we're saying what's the name of the obstetrician. All right, a couple more questions for the pregnant ladies. Do you have abdominal pain? ¿Tiene dolor en el abdomen? ¿Tiene dolor en el abdomen? Do you have vaginal bleeding? ¿Tiene sangrado vaginal? ¿Tiene sangrado vaginal? And like a lot of times you could phrase it slightly differently if you want to say tiene sangrado de la vagina, if you want to say from the vagina as opposed to vaginal, depending on just kind of your word choice that you like to use. All right, so we're switching from pregnant patients to young children or babies. So now we're talking about the babies or the young children. So asking the parent about them. All right, so the next question is, did the pregnancy of your child go full term? So of your child is in parentheses if you want to shorten it. Like, did the pregnancy go full term, or did the pregnancy of your child go full term? ¿El embarazo de su niño o niña llegó a término? ¿El embarazo de su niño o niña llegó a término? And so I said niño o niña, which means little boy or little girl, or baby boy or baby girl. So obviously you just pick one. So you could say el embarazo de su niña llegó a término, which would just be for a little girl. And then the next question is, any birth complications? ¿Alguna complicación en el parto? ¿Alguna complicación en el parto? So we're still talking about the babies. Next question is, has he or she received childhood vaccinations? ¿Ha recibido las vacunas de su infancia? ¿Ha recibido las vacunas de su infancia? How many wet diapers today? Or you could add in the past 8 hours for clarity. How many wet diapers today? Past 8 hours. ¿Cuántos pañales mojados hoy? ¿O las 8 horas pasadas? ¿Cuántos pañales mojados hoy? ¿O las 8 horas pasadas? Eating and drinking okay? ¿Está tomando bien? ¿Está tomando bien? So, yeah, the phrasing's a little different there. Tomar can mean eating or drinking. So you could add like, está tomando líquidos bien, está tomando comida bien. Depends on the age of the child, obviously, what would be relevant there. Yeah, so that's like liquids or food. All right, so that's it for the babies. Of course, these are all kind of incomplete. There'd be other questions you might want to ask, but we're just kind of hitting some of the high points. So the next group is dialysis patients. So first question, what days do you receive dialysis each week? Talking about hemodialysis, not peritoneal, I suppose. So what days do you receive dialysis each week? ¿Qué días recibe diálisis cada semana? ¿Qué días recibe diálisis cada semana? Who is your nephrologist or kidney doctor? ¿Quién es su nefrólogo o doctor para los riñones? ¿Quién es su nefrólogo o doctor para los riñones? So yeah, if you're paying really close attention, I added a word just because I said or, kidney doctor, and that's not written on here. But it's just like you could add that for clarity if you want to. And that's why it's in parentheses. All right, still dialysis. When was your last dialysis? ¿Cuándo fue su última diálisis? ¿Cuándo fue su última diálisis? Did you complete your dialysis? I'm saying it in Spanish. Did you complete your dialysis? ¿Se cumplió la diálisis completa? ¿Se cumplió la diálisis completa? So you could change the phrasing. You could say like se hizo instead of se cumplió. That's a little easier. Like, did you do the whole dialysis? This is like, did you complete the whole dialysis? So this is just like for extra emphasis. Like, did you finish the whole thing? And there's probably 1,000 other ways to phrase it. By the way, I didn't realize until I was putting this together that dialysis is a feminine noun. So I'd probably been saying it wrong all along. But now I know, and now you know. It's la diálisis, according to the internet. So, all right. So we're doing one last group and just a couple of questions for this last group. So for cancer patients, one thing you might want to ask them is, are you receiving chemotherapy? ¿Está recibiendo quimioterapia? ¿Está recibiendo quimioterapia? When was your last treatment with chemotherapy? ¿Cuándo fue su último tratamiento con quimioterapia? ¿Cuándo fue su último tratamiento con quimioterapia? So once again, that con quimioterapia is in parentheses because you could leave that off. They probably get it from the context, right? But you can always add that if the patient seems confused or whatever. So, yeah, so those are the special populations. Quick note, I've got these beginner lessons, high yield for providers in particular, 5 very focused beginner lessons on medical Spanish, which you can get just by going to my website here, learnmedicalspanish.org/lessons, learnmedicalspanish.org/lessons. I'll put a link in the info below, probably on the podcast and on YouTube. And if you're on YouTube, a couple playlists here where I have a bunch of other medical Spanish dialogues and similar things, kind of like this, and some very high-yield basic Spanish as well if you want to check out my videos about that. And some other links below. Check out the description below. All right, thanks a lot for watching or listening, and I'll see you next time on Learn Medical Spanish.